second year, going into my third year mental health student at Liverpool John Moores University.
My name's Stonehouse. I'm a third year, or soon to be third year, mental health nursing student. The reason this project came about is because in my first year at university I was on placement on a hospital ward in the local area, and I met a couple of patients who were deaf. So I taught myself a few basic signs, just using the internet and any books that I had, and went back in the next day and used these signs with the patients. It was quite funny at first because I don't know if they were right or not, but they seemed to work and we had a laugh.
We were having a conversation about BSL and I asked Sam to teach me a couple of things because we realised that it was actually quite easy to learn as long as you kept it quite basic. So we decided that this is something perhaps we could teach other people as well.
So we went about designing this project by getting together and kind of discussing, what the needs of these patients were, how we could improve communication and help break down these barriers.
I'm a HCA, so I had a look and think about all the things that I ask patients when they come onto the ward. So I wrote down a list of about 200 things that I talk to my patients about, and Sam reined it in a little bit and we narrowed it down to a more suitable amount.
We just wanted to come up with simple ways to teach new students some easy signs to use whilst they're out on placements so they could interact with the patients.
After we'd got the phrases that we wanted to use, we thought about putting together a presentation which took absolutely ages, but we didn't mind putting the work in because as we started to do the presentation, it started to come together, it started looking really good.
But personally, for me, the first few presentations I did were quite daunting, but we've improved as we've gone along, it's become much easier and it's been really fun doing it. It's been great getting positive feedback from students and staff across all areas within the university and elsewhere. It just seems to have been a really good experience for everyone involved. Basically just trying to get it out to as many people as we can, so that involves many students, staff members, nursing staff. So we're going out to hopefully speak at conferences, do workshops with people, seminars, and just try and get everyone involved.
At first, the project seemed that it was going to be quite easy. As we started developing it, it became way more complicated. But then we kind of got a grip on what we were needing to do. We stayed on track, and with all the help that we got from university, it became easier again and more manageable.
So far the videos have been really fun to make, and they've had a great impact on students. They've been used on the wards, people have accessed them on their phones, and just because they're so easy to access, they've just been a real hit.
I've had some really nice feedback from our fellow mentors. We've had great feedback from people who've been to see our presentation, who've actually used what we've taught them on the wards, which ultimately is what this was all about. It doesn't matter how big you feel your project might be, there are people in this university who will help you. We've had great support from John Moores, in particular Francis Colburn. So the advice I would give anyone who's got a good idea is go for it.
The thing I'd say to someone who is kind of doubting whether to go ahead with their project because of the size of it, I would say just go for it, because we thought this would be a massive undertaking, it'd be so big, but it's been really easy to do and we've had such good feedback, and it's been a pleasure, not a chore. Francis Colburn, it was an amazing help to us. She really helped us kickstart this whole project.
So we hope that we've been able to improve people's levels of communication who've come to see our presentation. Personally, I feel way more confident now when I'm talking to people on the ward. I've also had the opportunity to actually use some sign language as well on the ward, which I was absolutely delighted with. And it was a great opportunity to show the rest of the staff on the ward that we'd done the videos, and then they were able to use the videos as well to communicate with the patient.
Doing this project has been an absolute roller coaster, and I think it's prepared us, for when we leave uni and we want to undertake projects of our own, and it's been a really good learning experience for both of us.